Hey, future nurses. Miriam here, ready to break down a critical topic for your NCLEX and your nursing career, infection control. Acing infection control questions on the NCLEX isn't just about passing an exam, it's about building the foundation for a safe and successful nursing career. Trust me, mastering these concepts will make you a better, more confident nurse from day one. Think about it. Hospitals and healthcare settings can be breeding grounds for germs. As nurses, we're on the front lines interacting with patients with various illnesses and infections. Our job is to provide excellent care while protecting ourselves, our colleagues, and most importantly, our patients from the spread of infection. That's why understanding infection control is non-negotiable. It's about keeping everyone safe and providing the highest quality care. It's about being a true patient advocate. So let's dive in and make sure you're well equipped to tackle infection control on the NCLEX and beyond. Remember, a nurse who prioritizes infection control is a nurse who provides the best possible care. Let's get you there. So, what exactly is infection control? In simple terms, it's all the steps we take to stop the spread of germs and infections within healthcare settings. Think of it as a defensive strategy to protect yourself and everyone around you. Now let's break down the key components of infection control. First up, we have hand hygiene. You've heard it a million times and I'll say it again. Hand washing is your superpower. Washing your hands thoroughly with soap and water or using an alcohol-based hand sanitizer is the single most effective way to prevent infection transmission. Next, we have personal protective equipment or PPE. These are your trusty sidekicks in the fight against germs. We'll talk more about the specifics of PPE later, but remember that gloves, gowns, masks, and eye protection are designed to create a barrier between you and infectious agents. Cleaning and disinfection are also crucial. Think of this as maintaining a clean playing field. Regularly cleaning and disinfecting surfaces and equipment help eliminate germs and reduce the risk of infection. Finally, we have isolation precautions. These are special measures we take to prevent the spread of infections that can be transmitted through the air, by touch, or by bodily fluids. We'll delve deeper into the different types of isolation precautions in the next section. Remember, infection control is a team effort. By understanding and practicing these essential components, you'll be well on your way to mastering infection control and becoming a safe and effective nurse. Now let's talk about standard precautions. These are basic infection control practices that we use for every patient, regardless of their diagnosis or known infection status. Think of standard precautions as your everyday armor against infection. Why are standard precautions so important? Because we can't always tell who might be carrying an infection. Some infections don't show symptoms right away, and others can be spread even before symptoms appear. By following standard precautions with every patient, we create a safety net that helps prevent the spread of infection. So, what do standard precautions involve? First and foremost, hand hygiene. Wash your hands thoroughly with soap and water, or use an alcohol-based hand sanitizer before and after every patient contact. This is non-negotiable. Next, we have PPE. The type of PPE you use will depend on the task at hand and the potential for exposure to bodily fluids. For example, If you're drawing blood, you'll need to wear gloves. If there's a risk of splashing, you'll also need to wear a gown and eye protection. Safe injection practices are another crucial aspect of standard precautions. Always use sterile needles and syringes for injections and never reuse needles. Dispose of sharps immediately in designated sharps containers. Respiratory hygiene is also essential. Cover your mouth and nose with a tissue when you cough or sneeze and encourage your patients to do the same. If a tissue isn't available, cough or sneeze into your elbow. And don't forget to perform hand hygiene after coughing or sneezing. Remember, standard precautions are your first line of defense against infection. By practicing them consistently, you're protecting yourself, your patients, and everyone around you. Section 4. Types of isolation precautions. Contact precautions. Think skin to skin and contaminated surfaces. Droplet precautions. Think large respiratory droplets. Airborne precautions. Think tiny airborne droplets that can travel long distances. Download our free NCLEX study guide at nursecareerblueprint.com. Subscribe to our channel for NCLEX study tips and strategies.